Hello, my name is Antoinette Lachey Dingle. Today I will be doing an educational video on Otitis Externa. This video will cover the pathophysiology, eardrop administration, as well as prevention. The pathophysiology of Otitis Externa represents an acute bacterial infection to the external auditory canal, the auricle, and sometimes both. This bacterial infection, most commonly known as Pseudomonas aeruginosa or Staphylococcus aureus, are two of the primary causes of this infection. Otitis externa, which is also known as an earache, is most commonly known as the swimmer's ear. It's most commonly known of this because of the repeated exposure to water, and this allows the ear canal to become more vulnerable to inflammation. Symptoms of otitis externa include the following. You have a severe ear pain. It might start minor, but it gets very severe. Itchiness in the ear canal, discharge of fluid, pus, just depends on the severity. Some people experience hearing loss. There's a feeling of pressure and fullness inside of the ear. You can also have swollen glands and sore glands in your throat. Usually one ear is infected, but it can be both ears. Normally clears up within, say, roughly a few days or so, but it can persist over several months or even longer, and that then is considered a chronic symptom. So in order to treat this, we end up using eardrops. So I'm going to explain how we are to use eardrops. To begin with, first, you would need to wash your hands fully. Wash them with soap and water. After washing your hands with soap and water, then you need to warm the eardrops in your hands by simply holding them, because we don't want to put cold liquid inside of our ear. That's very uncomfortable for the patient, and at the end of the day, we are worried about our patient's comfort. Read the instructions. Should the bottle say shake it, you shake the bottle per the instructions. You then gently turn the affected ears up so that you have access to dropping and instilling the drops. For this particular patient, who is 16, you will pull the right ear up, or should we say, yes, up and back. And then you will then instill the correct number of drops for that patient. And again, that is all in the directions on the eardrop bottle. You need to keep that head tilted roughly 3 to 5 minutes to ensure that all the medication is absorbed, because if you turn your head back up too quick, it's going to just run out. It's not going to do the patient any good. Never touch that tip of that dropper to the ear, your fingers, or anything else. You want to keep it as sterile as possible so you don't add additional bacteria to the patient. So again, when you're putting it inside of the patient, don't touch any part of the ear at all. Just drop it in and then recap it without touching the actual pointer or the tip of the eardrop. Follow all directions that have been given to you by your provider. Should you still have questions after giving the medication or prior to giving the medication, you can always call the pharmacist if you're not able to get a hold of the provider, and they will answer all questions about that medication. In preventing, again, this prophylactic treatments to prevent otitis externa have not been evaluated in clinical trials, but there are things that we can do to help prevent this problem from happening. First and foremost, you need to keep your ears dry and as clean as possible. You need to turn your hair from side to side, getting all water out should you end up in the pool or in the shower, or get exposed to water in your ears any kind of way. The first thing you need to do is dry them immediately. Upon drying them, you don't want to stick anything in your ears. That is a sure way to cause damage to your ear, your eardrum, and cause ruptures. So you don't want to do that. You don't want to swim in polluted water, and you don't want to swallow water that you're swimming in. You definitely want to take care of your ears and realize that the place that you're going is sanitary. This video, again, has covered the pathophysiology, eardrop administration, and prevention in reference to otitis externa. It's been my pleasure speaking with you today, and I hope you all have a blessed evening.